Any other questions from any RAC members? If not, then we are open to comments by members of the public. I think some people came to speak. And so when you speak, could you first identify your name and if you represent an organization? Thank you.
Hello. Our names are Sue and Brad Wilson. We're from Western Springs, Illinois. We represent the Children's Medical Research Foundation and our daughter, Kirby Wilson, afflicted with Sanfilippo. A telephone call changed our lives. After giving me the devastating diagnosis on Kirby, I was told by our doctor nothing could be done. We should enjoy her while we have her. She's the same little girl she was yesterday. And the person we were told to call, representing a support group, told us doctors didn't care, buy a cage to contain her. We chose to challenge that doctor and that person, challenge our daughter's fate, form a foundation, which was the first of its kind for Sanfilippo, and raise funds for science, a cure for Kirby. And no, Kirby was not the same little girl she was yesterday. She was our almost 4-year-old daughter that was about to define fortitude and show us what facing adversities with grace was all about. So with her little hand in ours, we set out on our journey, our hearts filled with hope for her future. Since that time, almost 19 years ago to the day, we've devoted our lives to provide Kirby with the best opportunities possible. Our focus has always been her abilities, not her disabilities. Kirby's mission was song, dance, and happiness. Happiness for all around her. Her smile was infectious, and she asked just one thing of others. Happy? Mommy happy? Kirby's happy. Her words, now lost, will live in our hearts forever. Her message to find happiness in each day is something we strive to live by. Without words, she still speaks volumes. Our foundation has granted over $3.7 million towards a cure. In 1997, it was our good fortune to meet Dr. Haiyan Fu and fund the initiation of this work. Today, Brad and I stand before you not to ask you to solve our problems or take away our daughter's pain. We are simply asking you to allow Nationwide to take this work to trial, to see it through to a successful conclusion. Hope will not keep our daughter and others like her alive. A therapy will. You spoke today of risks to patients. I think all of our children afflicted with this devastating disease are indisputable proof of what doing nothing is. And we thank you very much for your consideration.
Thank you.
Good afternoon, and thank you very much for allowing us to be here to share with you today. My name's Elizabeth Linton. My husband and I, Randall, have traveled from Toronto, Canada, to share our story about our life with our daughter Alyssa and our passion for finding a treatment for Sanfilippo syndrome. Almost 16 years ago, our youngest daughter Alyssa was diagnosed with Sanfilippo syndrome at the age of 4. She was a bright, vibrant young girl, full of life and potential, and full of dreams. Doctors at the Toronto's Hospital for Sick Children told us of Alyssa's fate. They told us to take her home and enjoy her every day, because there is no treatment to stop her regression. There is nothing to treat her symptoms, because there is no research in Canada, very little happening in the world, and that was because there was no money for research. Soon after that, we connected with Brad and Sue Wilson, who just spoke. They inspired us with what they were doing in the United States by starting a foundation to raise awareness. We went back to Canada and we started a charity called the Sanfilippo Children's Research Foundation back in Canada. So with faith and determination, we have committed ourselves and everything about us to doing everything we could do to save our dear daughter Alyssa and change the fate for other families with children diagnosed with Sanfilippo syndrome and change the state of research in this world. I left my career and I started this foundation with my husband and have dedicated my life for the last 15 years to raising funds to support research out of the basement of our home, at the same time as caring for Alyssa's every-changing need and raising our 2 other children to adulthood. We are a true grassroots charity in Canada, the only one in Canada supporting research in the world. The SCRF is run solely by volunteer efforts, where 96 cents of every dollar raised has been committed to research. We have raised almost $5 million to date. This may not seem a lot in the scheme of research and the cost and the money that goes into it, but I mention this only because it has supported 32 research projects around the world, and over $1 million of these dollars has been committed to supporting the research efforts of the amazing team of doctors at Nationwide Children's Hospital. Because their work shows the most promise of moving closer to a treatment, we trust in Alyssa's lifetime. It shows more promise than any other research project that we have been involved with globally. What a legacy her life is going to leave. Raising funds has not come easy at all. It has meant many sacrifices for our family and many involved with us. It has involved a lot of prayers, blood, sweat, and tears over the years. We're not a large national charity at all or a pharmaceutical company with a lot of funds to contribute. We're just a family with an amazing community of people around us who are determined and committed to making a difference in this world, to finding a treatment for Sanfilippo syndrome, moving research forward so our children that are afflicted with this horrific disease will have a future, especially those that are yet to be born. Over recent years, a number of family foundations and fundraising efforts have been born in the U.S. and around the world because of the hope that has blossomed from the research efforts at Nationwide Children's Hospital, and a few of these families are represented here today. We have dedicated our lives to getting research to the point that it's at today. We are asking you now to help us with this vital research and allowing it to continue to move forward from here to the next level with a decision to allow these gene therapy clinical trials to happen. We see promise, we see potential, and we see hope in the work that is presented at Nationwide. Your decision today will not only impact the lives of Sanfilippo children and their families in the U.S., but those around the world, including our daughter Alyssa. We thank you in advance for working with us today, because tomorrow may be too late for our children. Thank you for your time.
Hello, and thank you for allowing me to speak here today. My name is Kara O'Neill. I've been a practicing pediatrician for the past 10 years. I'm an assistant professor at the University of South Carolina, where I care for children with special health care needs. I'm also mom to my beautiful daughter, Eliza, who's 4 years old. She was just diagnosed this past July with Sanfilippo syndrome. I just want to speak very briefly on the unique risks that Sanfilippo families tolerate when looking at clinical trials, and specifically with this proposed clinical trial. First, let me say that as parents, we would not put our children in a situation to assume risks that are greater than the potential direct benefit offered by a treatment, simply because their condition is terminal. However, it cannot be ignored that our children do have a fatal disease with no available treatments. It is also necessary to consider the rapidly progressive and disabling course of this disease when weighing how much preclinical data is enough data. Critical activities of daily living, such as speech, mobility, swallowing, can be lost in as short as a 3 to 6 month time span. As a community, we have educated ourselves on the science at hand. We accept the risks inherent in this gene therapy protocol. These risks are far outweighed by the possibility and potential of direct benefit to Sanfilippo children. The science is ready, the families are ready, and these children deserve a chance at life. Thank you so much.
Thank you. Thank you for letting us participate today. My name is Stuart Seidman. My wife Jennifer is here with me. We represent the Sanfilippo Research Foundation and our son Benjamin. Benjamin, unlike many other children, was diagnosed at 18 months of age. In a week's time, our family will celebrate his 18th birthday. 5 weeks ago, Benjamin left us. He's not going to be here to celebrate. In that intervening period, we watched him lose skills, mobility, speech, cognitive capacity, but never the joy, the laughter, and the inspiration he brought our life. Also during that intervening time, we funded Dr. Fu and Dr. McCarty's research for over a decade. Our scientific advisory board reviewed many proposals of many other protocols. This is one that we continue to fund over that time. It became apparent in Ben's life that there was a period where he would not benefit from this work, even if it went forward and were successful. But we still were here. We still continued our efforts. Benjamin is not with us. We're still here, and we still continue our efforts.
Because we believe in this research.
And we believe that it's an inspiration from our children, all of our children, and the children that are yet to be diagnosed, and Benjamin's brother and sister who are carriers and need to think about their future, that this research be continued and allowed to move forward. Thank you for your time.
Well, thank you all very much for it's always sobering and educational to us to know what it's about. Most of us are physicians or scientists or ethicists and deal with these things, but each personal story makes it so much more real. So thank you. I know it takes courage to get up and speak in front of a committee. It does for me. So any other comment before we have our session to go to our recommendations? Okay, so we'll take about a 5-10 minute break to go to our recommendation, then we'll reconvene.